Welcome back to Great Day Medical Monday. The loss of fully functioning teeth can be a long, drawn out and painful process, and it also eats away at your confidence and overall health. Our next guest has helped thousands of people like Sean Johnson.
Ms. Johnson, you ready to see your smile?
Yes! Oh my God!
They look beautiful.
Smile big, smile big.
Oh, hot mama.
Yeah.
Yay!
I love you, Dr. Obeidi.
Dr. Ali Obeidi, with Elite Dental Specialist, was able to change Sean's life by doing what he loves to do best. Dr. Obeidi is here with part of a series on educating us about dental health. He joins us with his patient, Sean. All right, flash that smile, Sean. All right, when I first walked in this morning, I looked at you and you turned around and you just went bam, right? And our producer said, she's got such a pretty smile. I go, guess why?
Thank you.
All right, Dr. Obeidi, a dentist is not just a dentist, is not just a dentist. The work you do requires extra training beyond initial dental school. So what does that involve?
Good morning, Deborah. Good morning. Really want to thank you first for having me back in your show. Just like we talked about it last month, prosthodontic specialty is a branch of dentistry dedicated to treat more complex cases. With 3 more residencies beyond dental school.
And we're not talking about a weekend class.
No. with 3 more full-time years of residency beyond dental school, packed with lectures, packed with hands-on training. A graduate prosthodontist is well equipped with knowledge and experience to tackle complex and more challenging cases, just like Sean's.
Yeah. And Sean, the thing is that you were going to dentist after dentist after dentist. It's not that they weren't trying to get you where you needed to go. It's just that they had an end to what their expertise was.
I was tired of patchwork.
Yeah, tired of patchwork, and it gets expensive, it gets frustrating, it's painful. All right, what was happening with your teeth? Because growing up, you didn't really have any issues with your teeth.
No,
right?
I didn't have any issues growing up with my teeth. Just over the years of with my health failing, with sickle cell and Addison's and autoimmune disorders, all kinds of things. You get Sjogren's or dry mouth, and some of that can affect your teeth. And I just got tired of losing and fixing a tooth and another crown, and back and forth.
Yeah.
And it gets expensive. And I'm like, I asked my dentist to send me to a specialist. I'm looking for a permanent solution. And that's when I got fixed up with Dr. Obeidi.
Yeah. You had even some medications impact,
Yes.
all types of things where it was like the issues that you're having in your body were kind of like a domino effect on your mouth.
Absolutely. Dr. Obeidi saved my life. He saved my life by fixing my teeth, give me a permanent solution. Now I'm more healthier. I probably don't even take nearly half of the medications I used to take. I'm working 2 full-time jobs. I'm doing just phenomenal.
We talk about self-esteem, but sometimes people forget that what you put in your mouth, when we say food is thy medicine, well, if you can't eat most of the foods because you have missing teeth or teeth that are painful,
Absolutely.
then how are you supposed to improve your health that way?
Exactly.
Yeah. When you say he saved my life,
He
that
did.
is not an understatement for you.
No, not at all.
Or an overstatement.
Not at all. My life has totally changed.
Wow.
I'm much more happier. My confidence, my ability to socialize with people is just phenomenal.
Yeah.
I remember when I met Sean's, she was wearing a permanent IV patch. Her medical condition was so on the edge that medical doctors, they needed to access to her body immediately with an immediate patch.
Yeah.
And now look at her. She's outgoing and she's going up.
And that is so true. I had an IV hooked up to me all the time. And it was because of, I had an infection, but I have not been sick or anything the last 3 years.
Yeah.
Phenomenal.
And she's one of several unique cases, because everyone who walks in your door is a unique case. It's not a one-size-fits-all.
No. We're not manufacturing certain procedure and try to fit everyone onto that. We are customizing the treatment for each patient, regardless of what their background or what their condition they come. We try to customize the treatment for them.
We know, like she said, implants can change lives. You see it every day. Let's take a look at one of your other patients and explain to us what their problem was and what you were able to
So
do.
she was just like an ordinary mom, bus driver. She had just like Sean's, a lot of problem with infection and gum problem. This is a kind of prosthesis I designed for her, and this is her transformation.
Yeah. Amazing, amazing, and I'm sure that transformed her life. And as a bus driver, how she greeted the kids and the whole
Yes,
bit.
exactly.
All right, our next
exactly.
patient here. Let's take a look at what they were dealing with. There we go.
Yeah, this is a wonderful immigrant to the country, successful, but went through a lot of stress in his life. Wore not all the teeth. You see, couldn't fix those teeth. So this is the kind of prosthesis again designed for him, and this is how it turns out.
Yeah, beautiful. All right, and let's take a look at our last patient.
And this patient, she's a owner of a mom and pop shop, working with her daughter, wearing a false teeth, and got tired of doing patchworks again, referred to me by her general dentist, and this is the transformation you can see.
Yeah, wow, just everything about them just lights up.
It does.
All right, there are people who've had implants done and they failed before. And so what should people look for in an implant specialist? And that's part of the reason why they had some issues before.
Yes,
with other
exactly. In dentistry, just like medicine, we have several branch of dentistry as a specialties. Complex cases in dentistry has to be done by a specialist. People have a better understanding of going to specialists in medicine than in dentistry. I'm giving you an example. For example, you have a cardiologist before in your show. Imagine, God forbid, you have a heart problem and you go to your family medicine doctor, right? They can do a electrocardiogram, right? They do, and they say, yeah, you have a problem. Most of the time, 100% of the time, family medicine doctor refer you to a cardiologist, to a heart surgeon to help you. But imagine that your family medicine doctor say, oh, Deborah, you need a bypass surgery, and I can do it an open heart surgery. I just got a weekend course on bypass surgery, and I can do it for you.
Yeah.
Okay, so what's your reaction? No, thank you.
Yeah,
right?
yeah.
This is exactly the same thing. In prosthodontics, in periodontics, we spent like 3 more years packed with training, with to be able to solve the problems and post-op problems. It's not going to be done just by.
Like you're looking at, is there an infection? Are there other ailments that are causing a problem? And you say research their education and their experience. Yeah. Look at previous work that they've done. Read the reviews. How does a doctor treat you? And you're like, I love you, Dr. Obeidi.
Definitely.
Yeah, because oftentimes when you've gone through a lot of trauma with your teeth, you're beaten down.
Oh yeah.
And you have almost given up. So when you walked into this office and you met Dr. Obeidi, that made a big difference for you.
Made a big difference. Just very kind, very caring. Listen to you. He listened to you. Him and his staff, they listen to you, and they find out the real reason and what you're looking for.
One of the other things you say to ask is how much of the work is done by assistants versus
exactly. You can find some offices that you go and the doctor meets you and do a procedure for you, and then you never see the doctor, and then the assistants or lab tech or other people seeing you for several sessions, and at the end of the treatment, at the end of work, the doctor say, hey, yeah, oh, nice, good,
Yeah.
and then leave. So in our office, I do all the main procedures needs to be done for the patients, and I oversee all aspect of the treatment myself.
Yeah. Okay. Sean mentioned that she was tired of the stopgap measures, which were expensive and would eventually fail. This is one of the implants are the gold standard, but as a lot of us know, these are some of the patchworks that we're talking about. Every grandchild, I think, at one point was frightened when they walked into their grandparents' room and saw this sitting on the nightstand. And these are your traditional dentures, right?
Yes. So missing teeth, we have different options to treat the missing teeth. We can. This is a very, very old technology, 200 years technology.
Oh, wow.
We can do dentures dentures can be done only for a set of teeth, or can be done only for one missing tooth.
And the tough part about this is that you're still losing bone when you have these in, right?
Exactly. There is if you have one missing tooth, there is an option that what we do, we cut the teeth and prepare them and make a bridge for you.
Right.
This is kind of a bridge.
But still not as stable as an implant,
This
right?
is not. This is not a real tooth. Sorry.
Yeah.
This is not a real tooth. This is just a bridge between two teeth. But if you want the real solution, we have the implants. This is kind of like an implant, and then implant is going to be sit into the bone, and then we make a connection. And then we make a crown on top of this. This is like a real tooth.
And there you go. And you can replace just one tooth, or you can do some teeth to serve as anchors for an entire mouth, right?
Yes. So implants can help for one tooth, for a couple of teeth, or even for full arch. Implants can help to make a denture more stable. This is a denture. See how stable is this?
There you go.
Okay, so
Yeah.
and so we have two implants here that the denture can sit on top of it. We call these over dentures, or they can eliminate the need of denture by a full arch. Sometimes we call it all on four. Sometimes we call it full arch prosthesis with implants. So like 4 implants, 4 to 6 implants, and a full set of teeth that is not moving and is not be able to take out. There is
in
no.
that case, it's like literally, it is almost, for many people who've struggled, almost better than anything they've ever had in their life, better than their natural teeth even.
Exactly.
Yeah, we love natural teeth when they work fine, but if not, this is the best thing. I'm going to end with you, Sean, what you have to say to somebody, because I know somebody out there right now has been struggling, has been compensating, eating on one side, not the other side, and the whole bit, afraid to come in. What do you have to say to them to finally get this done, the platinum standard?
I would say to you, go out there and take back your health. Take back your health, take back your life, and smile more.
Yeah. And you literally say, take back your life, because now you went from having the patch, the infections, all those types of things, to working 2 jobs and smiling all the time.
Absolutely.
Elite Dental Specialist has an exclusive offer for Great Day Houston viewers. Call to make an appointment for a one-on-one consultation with Dr. Obeidi, which includes assessments and 3D cone beam radiography. The consult fee and that 3D x-ray are a $450 value, but you can get it completely free by calling now to get pre-qualified. You must mention Great Day Houston to receive this offer. Call Elite Dental Specialist at this number, 281-397-3352. Again, that's 281-397-3352 to secure your spot now. And for more information, visit their website at elitedentalspecialist.com. Thank you very much.